This piece of Lisa is being brought to you by Mutual Security Credit Union. Find out more at mscu.com.
President Obama has issued a series of regulations via Kathleen Sebelius in which they are attempting to make insurance companies pay for a host of women's services that were not heretofore required in your private insurance plan. And among them are breast pumps to encourage breastfeeding, but also they're also birth control, and that includes the morning after pill, and it does not include abortion, but it includes the birth control pill itself. And a number of religious organizations, including the Catholic Church and the Family Research Council, have opposed these new regulations, and the Church, specifically the Catholic Church, saying that contraception in itself is immoral. What do you think? Do you agree with that? And do you agree with the influence and sway that they have over the dialogue? Let me tell you how much sway they have. The regulations include religious exemptions for institutions like the Catholic Church who employ people and who have health care plans. They don't have to cover these services. They don't have to pay for birth control. So if you're a woman and you work for a Catholic hospital, you're a nurse, and maybe you work for St. Raphael's, or there are a million wonderful Catholic hospitals, a million of them, St. Jude's, how many are there? Tons. But if you happen to be your average everyday employee, and you may not be Catholic yourself, under your plan, the Catholic Church gets to exempt your birth control pills simply because they don't believe that you should be engaging in that kind of behavior. They are taking a moral stance with respect to your personal sex life, even though they're your employee, and they're saying, we don't want to have to pay for insurance coverage for this because we think it's immoral for you to go about your life to try and prevent an unwanted pregnancy. I find this to be wrong in so many ways, totally wrong. And I disagree with the policy of the Catholic Church. I disagree with the policy of the Family Planning Council, or whatever this is, Natural Family Planning. I disagree with the way in which Planned Parenthood continues to be reviled and continues to be shunned and continues to be treated as a controversial organization simply because they provide a service that in many states is still perfectly legal. We know federally it's legal, but in many states they've gutted it so much that it's virtually illegal, and that is abortion itself, but also provides pelvic exams and a lot of counseling, prenatal and otherwise, and also helps women avoid unwanted pregnancies, which is, after all, should be the goal of everybody. Nobody wants women to be forced with the decision, with the dilemma of what to do when they have an unwanted pregnancy. And that decision and dilemma is as old as we are. It's as old as the human race. You can read about it in the Bible. It's even there. They even talk about unwanted pregnancies even in the Old Testament. And I can't cite you chapter and verse because I am not a maven on the subject, but I have listened to a few sermons on the subject, and I know that it's there. And so for the Obama administration and its regulations to be exempting certain religious employers from this, I understand why they're doing it. They don't want to get into a church and state divide. But do you think that it's right for these religious institutions to go ahead and take advantage of these exemptions? Because I don't. I think unless it's a nunnery, in other words, unless it's a place, and I don't mean that because of chastity, I mean unless it's an institution in which all the people of the institution are of the same faith, that I can understand. But listen to this exemption. A religious employer is one that, one, has the inculcation of religious values as its purpose. Well, that could cover a million things. 2, primarily employs persons who share its religious tenets. That I agree. 3, primarily serves persons who share its religious tenets. And 4, is a not-for-profit organization under the Internal Revenue Code section. So what would be a Catholic hospital? I'm curious to know. A Catholic hospital could argue that it inculcates religious values, that it's about serving the sick and helping the poor and the sick. But does it primarily employ Catholics? I don't really think that that's true, but what do I know? Or primarily serve Catholics? This is going to be interesting to see the way this is argued. This is going to be very interesting to see that this is argued. And should birth control altogether be classified as preventive health care? What do you think?
You've just been listening to A Piece of Lisa. If you'd like to listen to the whole 2-hour show, please go to lisawexler.com, where all shows are archived. And do follow me on Twitter at Lisa Wexler. Thanks for listening.